This is All India Radio. In the program Spotlight, now we bring you an exclusive interview with Atul Kumar Tiwari, Additional Secretary, Ministry of Skill Development and Entrepreneurship, on customized crash course skill development program for COVID-19 frontline workers. The interviewer is Ruchika Chitravanshi, journalist.
Prime Minister Narendra Modi today said that India needs to be prepared to combat the new challenges that are being posed by the virus, and in working towards this, one of the very important things is our frontline workers. He has said that we are preparing 1 lakh frontline workers for the country. We have with us Mr. Tiwari. Can you tell us a little bit about Prime Minister's announcement today? What is being done to prepare this workforce, and what will be the role of the Skill Development Ministry in making sure that this happens?
Everybody knows that COVID crisis is a global phenomenon and every country has been badly affected by that. And during this time, our health services have been working overtime, our doctors and nurses. Prime Minister even mentioned about the Anganwadi workers and the ANMs and ASHA workers also, who are doing such a great work in the rural areas. Basic intention of this program is that we keep ready the human resources required for healthcare, and how do we train them in a most efficient manner so that trained, skilled healthcare frontline workers are available in our health services, diagnostic centers, etc., so that whenever the next crisis starts, at least we will not have a shortage of the manpower. That was the basic intention behind this customized crash course on COVID-19 frontline health workers.
Customized crash course that has been designed, it is part of the Pradhan Mantri Kaushal Vikas Yojana. What is the total amount that government will spend on this, and what are the kind of training centers that we will have? What are the job roles that will be covered by this scheme? Can you tell us a little bit about it?
This customized crash course is being taken up under Pradhan Mantri Kaushal Vikas Yojana. And as it is, we do a training in so many diverse job roles. But because our country needs strengthening of the healthcare system, that's why we are concentrating on these job roles. Now, what kind of job roles are required? So we had a detailed discussion with the Healthcare Sector Skill Council, which is headed by very eminent doctors. Dr. Naresh Tihan is the chairman. Then we have Dr. Devi Shetty. We have Dr. Guleria. So all the eminent doctors and the hospitals, we consulted them and said that what is that you require? So they identified 6 job roles like GDA, home health assistant, emergency medical technical assistant, then sample taking, like that's 6 jobs roles were decided. Then we asked them that we wanted them to be made quickly. So generally the trainings are done in 3 months. So what we did was that we customized crash course, which is for 21 days to 27 days, followed by the on-the-job training. So what would happen is that the candidates, when they get into that, depending upon their qualification, for example, for the emergency medical technical assistant, they require something higher qualification than the GDA or the home health assistant. They will be assessed after the theoretical course in our PMKVY Pradhan Mantri Kaushal Kendras. Then they will be made certified fit to be deployed in the healthcare diagnostic centers. There they will undergo 3 months of on-the-job training. After that, again, they will be assessed and then certified. So the idea was that we give them basic theoretical training and then expose them in a real-life situation so that their skill in working in a real atmosphere would further improve. And the budget for this is around 273 crores, which we anticipated for around 1 lakh such healthcare workers, which includes 90,000 of the fresh skilling and 10,000 for the re-skilling. The re-skilling is important because for last so many years, PMKY has done skilling for so many youth, and we assume that around 10,000 of them, we have been talking to them, 10,000 of them would require re-skilling, so that after 1 week of re-skilling, immediately they can be deployed to the health services as well.
Who are the people who can take benefit of this scheme, and how can they enroll for it if they want to get trained in any of these different 6 job roles, for instance, that you've talked about?
As Honorable Prime Minister also mentioned, we are doing a demand-driven method. So in our Skill India app, we asked all the state governments and district administrations to give their demands. And we have a thing called District Skill Committee, which is headed by the local officers, collectors, some places, and serviced by the district level officers for the skilling, etc. So they had to analyze their district level situation and suggest to us what would be their requirement. And based on the requirement, the mobilization is also done by them. Then we have our training providers. They also help the district skilling committee to mobilize. And as you know, for all such skillings, there had to be NSQF, National Skilling Qualification Framework approved. So in that, we took the emergency approval of the NCVET. And there the entry-level qualifications are given like 10th standard, 12th standards, or having science or something like that. So whoever qualifies that and above a certain age limit, which is quite evident, they have to be adult, they can apply for that and then they can get themselves skilled and trained.
As you said, demand-driven. So if the demand is more, then you will train more people as well, I understand.
Certainly the resources are limited. We also have limitations in terms of the training centers available, but we will try to cover as many districts as possible and keeping the 1 lakh target which we have set for ourselves. And if the demand increases or the facilities are cohere with our requirement, then certainly we can consider later for more people.
Mr. Tiwari, this whole announcement around the customized crash course program and ramping up of the frontline workers, it's coming at a time when India is coming out of a very, very horrible second wave. There is fear of third wave. So how do you see these frontline workers getting utilized? Because there's parallelly also one of the world's biggest vaccination drives that are going on. How do you see this workforce that will be trained getting deployed on ground?
We want to increase the manpower pool of skilled people by new young people. And what is happening is that because of the corona, our health services are under unprecedented stress. They are overstretched everywhere in every state or district. So while the government is doing everything it can for providing the capital infrastructure in terms of oxygen plants and having more hospitals, etc., we also need to look into the aspect of the people who would be working on these health services. So since the demand is going to burgeon and there is an increased emphasis on the health services these days, so we'd also expect that the health services would also increase in the country in all our other districts. So we need the manpower for that. And that is why we have taken this focused approach to have these 6 job roles, as I told you earlier, has been approved and recommended by the experts in the health sector skill council. First of all, they will add to the manpower, skilled manpower available. Second, when they are deployed into the health services, the overstretched our doctors and nurses and paramedical staff who are doing a lot of routine works, they will also be relieved and they can, the burden on them would decrease and some of the burden will be taken up by these young people and the trained medical professionals, doctors and nurses, they will be able to take better care of the patients rather than doing the routine work. So resource pool, at the same time, they are also relieving the pressure on the trained medically certified manpower as well. So on both these fronts, they will be help us in meet the challenges of the corona, whichever the wave comes, because as Prime Minister was saying, the virus is mutating and it can take many other forms. And unless until we come to a certain level of vaccination, this threat will always remain. So we have to be ready for such eventualities. And that eventuality is one of the ways, in our very humble way in the skilled ministry, we are trying to add to the skilled frontline healthcare workers.
So this resource pool that you will create, will it be absorbed by government facilities or also by private facilities? And how long is this training program as well? So we can get an idea as to when will this workforce be ready to be utilized?
Today, we have started this around 100 training centers in 26 states and UTs, and which will take almost 6,000 young people will be trained. We are going to take it over the phases. As you know, the lockdown situation in many parts of the country. Then we also have to see the readiness of the training partners also to be available. Infrastructure also has to be available. And as our Honorable Prime Minister was saying, that these people are going to deal with the people, their health, etc. So they have to be properly trained. So depending upon those limitations, we are trying to talk to the state governments and district authorities, opening up the training centers. For example, today is also many parts of the country are closed, but we took a special permission from the chief secretaries and the district magistrates to open the centers so that they can allow these trainings to continue and the movement passes for the trainers and the trainees, etc., etc. So our idea is that we'll go ahead and say by July end that time, we'll be able to ramp up all our infrastructure and our efforts so that we have the people under the scaling process.
Mr. Tiwari, you mentioned how there is obviously a limit to the resources you have. There is a certain number of training centers and obviously a certain number of trainers also that you have. Is there a big challenge in this area, and do you have any estimate of the kind of demand that you would see for this crash course that is being launched?
See, we set up a target of 1 lakh, and then, as I told you, we requested the state governments to give their demand, UTs to give their demand. And you will be surprised to know we got a demand within 3 weeks, 2,80,000 demand. So there is a demand there. Second point is that this is the district skilling committee headed by the district commissioner, etc., who are the local authorities, district administration. We have left it to them where they will be trained or where they will absorb. As you wanted to know the timing, it's around 3 weeks of theoretical training and 3 months of on-the-job training and assessment. So we assume that because the trainings will be very, very useful and worthwhile, where theoretical as well as practical trainings are combined and then the assessments are being given, we're also trying to increase our monitoring processes, etc. So as a result, the quality of the training will be very realistic, very, very high. I'm sure that the many private health facilities would also be willing to take it. We also have the backing of the Health Sector Skill Council as well. So we try our best to work not only with the government, but also with the private agencies so that they are able to be employed. And one criteria for employment is how good they have been skilled. And that is within our hands, and we'll try to give them as best skilling as possible.
Obviously, the COVID situation has brought health in a focus as never before. And this announcement too is being done in the light of the whole situation that has been thrown at us because of the pandemic. Now there is a focus on the health sector, and we are realizing that human resource crunch is one of the biggest challenges that the sector faces. How do you see this program going forward beyond the pandemic?
Before I say anything, I would like you to be clear that there are two parts of the human resources for the healthcare. One is the trained medical care, for example, doctors and nurses and paramedics. That part is also being ramped up, as Honorable Prime Minister also said. We have opened so many new hospitals. There is, as you know, renewed emphasis on ramping up our health infrastructure. So that is being done on the medical care part. What we are talking about is the non-medical, but very essential healthcare. That part comes under the ambit of the skilling ministry. And we have started on this process, and hopefully now this will give us certain resilience and certain capability so that taking this example forward, we will like to meet any challenges which come ahead of us.
You'd also mentioned earlier how you have discussed with the private sector. You mentioned how Dr. Trehan, etc., have given you suggestions of the kind of skills that are required. Are you also collaborating with the private sector in imparting training to these frontline workers? And what are the kind of tie-ups, if at all, have you entered into?
One part which I am talking about is the government-funded skilling, which the parties do not need to pay anything. It doesn't discount the fact that the many private hospitals and private hospital chains as well, they are also imparting training for their needs. And these are the kind of the paid training. So as I am saying, many big private hospital chains, even smaller ones, they're also training them. And those kind of people or manpower is also being generated. So I assume that in a country like us, both parts are very important. One is that what the government does and what the private sector does based upon their requirement. And both have to work together so that we can create sufficient number of manpower.
One last thing that I wanted to ask you about is that the availability of these frontline workers is also quite skewed from state to state. So when you are providing these training courses, is focus more on some states? Do you see on the basis of the demand coming from that state or the COVID case burden in that state, are any of those factors also into play?
Certainly. When we receive so much of demands, then the question arises, how do we allocate our targets to different states? And one certainly is the population. Second is the concentration and spread of the health services, etc., whatever the data which we have. But more important is what are the states have demanded. So we have tried to come up to that level so that as far as possible, the smaller states and their demands are met fully. And for the bigger states also, we are trying to, as much as possible, within the available target. And we're trying to do so that the satisfaction ratio, as we call it, is sufficiently high.
Absolutely. many lessons in this pandemic, and this certainly is one and a step in the right direction. Thank you so much, Mr. Tiwari, for joining us and sharing us your very valuable insights with us. Thank you so much.
Thank you so much.
You were listening to an exclusive interview with Atul Kumar Tiwari, Additional Secretary, Ministry of Skill Development and Entrepreneurship, on customized crash course skill development program for COVID-19 frontline workers. The interviewer was Ruchika Chitravanshi, journalist. This program was produced and presented by the News Services Division of All India Radio.